So an overview of the talk tonight. We're going to look at the scope of the problem of cardiovascular disease in our country. We're going to look at the mechanism for how and why heart disease happens, otherwise known as coronary heart disease or CHD. We'll review standard laboratory testing, and you all know much about these, the cholesterol testing, the HDL and LDL and things like that. We're going to talk more about that standard testing and how to understand it better. We're going to introduce some advanced laboratory testing to try to find risk in people that the standard tests don't inform us about, so it's important. We're also going to look at some advanced imaging to help us understand more about the vascular health in our body. We'll talk about the ultrasound of the carotids that will tell us about vascular disease, and we'll talk about this new CT scan that can give us some real information about any individual's risk. So a lot about what I'm going to say tonight, it talks about what lowers the risk in a population, but what's really important is what lowers the risk in you or the patient that's sitting across the table from me at the office. We want to know more about this personalized medicine, how we can lower your risk. And as always, because my clinic is founded on nutrition first, we're going to talk about nutrition and lifestyle as an important way to lower our cardiovascular risk. And last, we'll talk about medications, and we'll also talk about supplements that can lower cholesterol and can lower cardiovascular risk. I also want to just open it up to the group here that if you have a question, let me know. Please raise your hand. We'll answer it as we go, because I want everybody to really take home the important things for them. So if there's something you don't understand, just raise your hand, and I'm sure that if you're having some difficulty or some question about it, that others are too. So heart disease is the leading cause of death in both men and women. 1 in 4 of us will have serious heart disease and actually die from that. It's such a big deal that it's the #1 health concern in the US. There's 640,000 deaths a year related to cardiovascular disease. And when I say cardiovascular, I mean diseases of the blood vessels of the heart and diseases of the blood vessels of the brain, stroke and heart attack. So there's 500,000 strokes a year, and there's 500,000 heart attacks, and about 140,000 strokes a year. I also want to mention here real quick is that in that slide packet that you have, there are a few slides that I've taken out that you won't find there. So it won't follow exactly, but all of the slides that are up here will be in there, and generally in this order, but not completely in this order. So we know the standard risks for heart disease and stroke, and the standard risks are things like high blood pressure and diabetes and high cholesterol. But we also want to know and uncover some of the other risks that that isn't quite apparent, and that's when we use some of this advanced testing that I'm going to talk about, and we're going to use the imaging, the ultrasound and the CAT scan. So when I grew up in medicine in the 80s, it was clear that cardiovascular disease and heart disease was just a plumbing problem, right? That those arteries just clogged with fat and cholesterol, and sooner or later the blood wouldn't flow anymore. Well, it turns out what we thought in the 80s is not what we know now in 2016. We know that 68% of people that have a heart attack have a blood vessel that's less than 50% clogged. More than half the people that have a heart attack because the blood vessel is less than half clogged. So that means it's not just a simple plumbing problem. There's more to it than that. And it's really a lot like a volcanic reaction. An eruption that happens in the artery that's about half narrowed, and it erupts in a way that causes an immediate blood clot, and then stagnation of blood flow, and then death of the tissue of the heart or the brain from the area that doesn't get the blood flow that's further downstream. I'm going to get a little scientific here tonight, but I hope to really bring it home in a practical way for everybody. Inside the blood vessel, what happens first in the lining is that the blood vessel gets injured from things like smoking and stress and high blood pressure and things like that, and then cholesterol can sneak in underneath the lining of the blood vessel. And then things get inflamed and blood cells come like macrophages, and they start to make a plaque, a deep plaque in the artery. And then what happens, if the plaque is stable, you just have a little bit lessened flow. But if you have an eruption, actually an unstable plaque, things can erupt, and then you'll have that clotting that stops the blood flow immediately and causes the heart attack or stroke. So this is actually a pathological, a real specimen from a human being that had a seriously narrowed blood vessel, about 50% there on the left. And on the right, what happened, different person actually, that cap that's over the plaque of the cholesterol in the artery broke open. It was an unstable cap, an unstable artery, and then it broke up in such a way that it allowed the constituents of that plaque to get into the blood flow, and that causes that cascade of things that occurs that cause that heart attack. This is what happens most commonly. Now, it turns out that unstable plaques are something that we have control over. We have not only do we have control over building plaques by keeping our cholesterol down and our blood pressure right, but we can keep that stable lining, the cap over the lining of the plaque, very stable. But if we do the wrong things, if we have too much stress, not enough exercise, not the right foods in particular, you have a much higher likelihood to have an unstable plaque and have this event of a heart attack. So heart disease is a big deal in this country, one of the number one medical concerns, and there's keys to preventing it, and we're going to talk about those tonight. Now, I'll bet you that some of you, and I won't ask for a raise of hands here, but I bet some of you are on medications to lower your cholesterol, statin medications, right? And in medicine in general, when a person has high cholesterol, what we say is, you know, if you have the high cholesterol and maybe some risk factors, you need to have a statin medication. That's pretty standard throughout medicine. That's an important solution for many people. But it's also important to recognize that statin medications, they're not a cloak of armor. You know, if you don't take care of the other pieces, and I'll talk about those other pieces in regards to lowering your risk, statins don't do much good. They don't do much good. In some people, we use statin medications probably when we wouldn't have to, if we got their exercise right and we really understand their individual risk. And I'm going to talk about how statins have both positive benefits and some negative side effects. And it turns out that in medicine, the medications that have the most positive benefits often have some of the most serious side effects. So if it's a powerful medication on one side of the balance, it's often powerful enough to cause some side effects too. I'm going to also talk about, in an example coming up, of a person that has a normal cholesterol but really needs to be on a statin medication. Because when we work through their risk for cardiovascular disease, it was high enough that they needed to be on a statin medication. So some people aren't getting them when they need them, and some people are probably getting them when they don't need them. The power of prevention. This is a very important study in 2009 in a major medical journal. And they said if you do 4 things, if you eat vegetables on a daily basis, we can do that. If you move daily, we can all do that. You maintain a healthy weight, and that means being less than obese. It doesn't mean being thin. A man, 5'9", less than 200 pounds. A woman, 5'6", less than 170 pounds. So we're not talking rail thin here. And you need not smoke. If you do those 4 things, you can reduce the risk of many diseases. And I don't know unless you've seen this before, I don't think you'll believe how powerful this is. You can reduce the risk of diabetes by 93%. Those 4 health behaviors, clearly proven in medicine over and over and over now. You can reduce the risk of heart attacks by 81%. You can reduce the risk of stroke by 50%, and the risk of cancer by 36%. Wow, that's really impressive. And imagine what we could do in regards to lowering the healthcare cost in our community, for our families, for the country, by just using those 4 health behaviors. And you'll see that the statin medications, although they're helpful, they pale in comparison to how powerful lifestyle and nutrition is. So let's talk about statins more in detail here. If you're trying to prevent the first heart attack, it's called primary prevention. That means you're giving a man or a woman cholesterol medications, a statin drug, to decrease their risk of a first heart attack. We look at a number, it's called the number needed to treat, to show how powerful that is. You have to treat 104 people every day for 5 years to prevent one heart attack. 104 people every day for 5 years to prevent one heart attack with a statin. Now, in my practice, I want to prevent every heart attack, but that ratio is not that powerful. Then we look at a number called the number needed to harm. 1 in 50 people who take a statin medication will develop diabetes. 1 in 10 people will have muscle damage. Most of the people that take statins tend to be heavier. They tend to not exercise as much. They tend to not take care of themselves as much, because when they get up in the morning and they take their Lipitor or their Zocor or their Pravachol, they put on that cloak of armor, and then they walk out, and who knows what they have on the way. Maybe they stop at a fast food place and get their breakfast. Maybe they have so they think they're kind of impervious to heart disease when they take their statin. They're not. So the number needed to treat and the number needed to harm is important. Then there's secondary prevention. How good are statins at preventing that second heart attack? And here, medicine is pretty clear that we think that the numbers are solid for preventing the second heart attack. So we look at the number needed to treat. You need to treat 39 people every day for 5 years to prevent one heart attack. So much better, but it's still not a cloak of armor. So that's one of the most important points you take home here tonight, that prevention is very, very powerful. And if you need a statin, you want to make sure that you're doing the preventive things as well. And then you have even more power. The number needed to harm is just the same as it would be for primary prevention: increased diabetes, increased muscle damage. Now, this is a study from last year in January, and it looked at people that were on statins, and what they showed was that there was a 46% increase in the risk of diabetes in the people who took statins every day for 6 years. Did you realize that? I'm sure that you've heard some of these things in the news, but this is a major medical journal, January 2015. It's worse in women. It's worse in women in regards to the increased risk of diabetes. So the American Heart Association has the Simple 7, and they look at getting active, eating better, losing weight, stopping smoking, managing stress, reducing blood sugar, managing blood pressure, and lowering cholesterol. And in medicine, we're pretty darn good at watching the sugar, and we're pretty darn good at watching the blood pressure, and we really focus on watching the cholesterol. But what we don't do is really look at those other 5 things on the other side. We often jump to using a statin medication. You've seen this study before. I won't go over it again, but there's immense power in prevention, immense power. And it does, when you look back at the 1 in 104 people that need to be treated for the first primary prevention of a heart attack, it doesn't compare to this in any way. It just doesn't have the same oomph. So the other thing that's kind of interesting, although cholesterol is clearly a factor in heart disease, there's no question about that. 50% of the heart attack victims in this country have normal cholesterol. So that's why we need to find the hidden risk that we're going to look at more carefully. And this number, I think, kind of dumbfound some of us, because we really thought that, that cholesterol was the factor, right? This is a study from 2000 to 2006, and they looked at 136,000 people that were admitted to the hospital for heart attacks. The blue bars are the ones that had normal cholesterol. Much more than half in this study had normal cholesterol readings. To the standard testing. We're going to talk about the advanced testing in a minute. So Einstein is one of my favorite people of the 20th century, and he said everything should be as simple as possible, but no simpler. Coronary heart disease is not as simple as lowering cholesterol. And preventing heart attacks is not as simple as giving a statin medication. These are the standard risk factors. And all of your doctors look at this in you and your family members. If you're a man older than 50, you have an increased risk, a woman older than 60. If you smoke, if you have a family history of heart disease, if you have high blood pressure, elevated cholesterol, or diabetes. So all of these are the standard risk factors for cardiovascular, particularly heart disease. This is the standard testing, and I think this will help you remember it better than any, I hope, possibly better than any other way you've thought about it. So cholesterol is not bad, but bad cholesterol is. Total cholesterol equals both the good and the bad. The LDL now, you know, the LDL is the lousy cholesterol. The triglycerides are the terrible triglycerides. And the HDL is the healthy cholesterol. Most labs measure LDL cholesterol by measuring the weight of the LDL in the specimen. They measure the weight, and that there's a flaw in that measurement. It turns out that what we need to know more about is how many particles of LDL, how many little molecules of LDL are floating around, because some are big and some are small, and the big ones are pretty good, and the small ones are really nefarious and dangerous, really dangerous. So they come in all of these different sizes, and way over on the right, you see something called SD-LDL. That's small, dense LDL, and those guys can easily penetrate into the artery walls and start that process of damaging, causing a plaque, and leading to the possibility of rupture. So we're going to look at here a situation where the LDL cholesterol is 130. So both on the left and the right, it's 130. But on the left, because they're big LDL particles, there's not too many. And on the right, when they're small and dense LDL particles, there's a lot more. So one of the things that we can test, and you can ask your doctor to test this now because standard labs will do this for you, you can find out what your LDL particle number is. So more than knowing what your total cholesterol is, more than knowing what your LDL cholesterol is, it's knowing what your LDL particle number is. That's more important, tells us more about your risk. It defines your risk as an individual much better. There are advanced lipid profiles available. Lipid means cholesterol or fat in the blood, and there's advanced profiles available now, available to your doctor and available in my clinic as well. We use these all the time. This is called the Boston Heart Lab, and it has many, many different things. You know, just the very top of it, just the very top is the standard cholesterol, the HDL, and the LDL, and the triglyceride. But there's a whole lot of other markers on there, and that's the advanced panel. And I'm going to go through some of these important ones. Fibrinogen at the top right is a blood protein that increases our risk of clotting. So if somebody has high fibrinogen, they're at higher risk. If they don't have the right size HDL particles, now we can measure the HDL particle size. And if they have small HDL molecules, they're not very good. If you have elevated homocysteine, homocysteine is a blood vessel toxin that we can measure in the blood. It can be done at all of the standard labs. And if it's elevated, it increases your risk of blood vessel damage and then the cholesterol buildup, et cetera. Now, these three in the middle that are in bold are clearly the most important. The one is hsCRP. That's a marker of inflammation. And we know that cardiovascular disease is both the cholesterol, which is kind of the fuel, and then the inflammation, which is the fire. And somebody can have fairly high cholesterol but have not much inflammation and have stable plaques. But if you get inflammation inside that artery, that plaque ruptures, the cap becomes thin. And what's interesting, and we're going to talk more about food at the end, I guarantee that. What's interesting is within just about a month, if you change your diet, you can decrease the inflammation on your blood vessel walls significantly and lower your risk for heart disease very abruptly in just a month. And what's interesting about that is you would have done nothing to change the plaque in the arteries because you can't change that in a month. You might change it in a few years if you were really great at it, at taking care of yourself. But you change the inflammation on the blood vessel lining, and it happens quickly. The next one is the LDL particle number that we talked about. And then the small, dense LDL. How many of those small, dense guys do you have around? There's a few other at the bottom, lipoprotein A and LP-PLA2, in myeloperoxidase, and this tells us more about inflammation in the blood vessel lining. So this is an example, and I want you to help me doctor this patient. This is a patient that has a total cholesterol of 198. So does he need medication? Yeah, I see a lot of no's on that one. Total cholesterol 198, HDL 35, maybe a little low. The triglycerides 112, normal. LDL less than 130, normal. So this person, by basic testing doesn't need any treatment. Well, it turns out when we did an advanced risk analysis on him with that testing I showed, fibrinogen was normal, but the HDL particles were very low, and those are the healthy, remember, the healthy cholesterol particles. The homocysteine, that vascular toxin, was high. HSCRP, that fire that causes the fuel to burn, was very high. The LDL particle number was 1,850. That's very high, very high. The small dense LDL, those nefarious little guys, very high. Lipoprotein A was okay. LPPLA2 was okay, but myeloperoxidase was high. Now, that person needed, the last slide, that person needed to have further imaging to understand his risk, and we'll talk about that imaging in just a minute. So this is a woman that works here in the hospital. I won't give her away, but she works here in the hospital, and her cholesterol is 260. Does she need medication? Well, her very conscientious, very competent family physician said, yes, let's put you on some medication. And she came to me and said, well, can you help me with this? Do I need medication? Is there anything I can do to lower my cholesterol naturally? I said, well, let's look more about your risk here. So we did the standard cholesterol panel. Her LDL was 148, which is clearly high. But notice her HDL is 82. That's the healthy cholesterol. That's an overwhelming amount of healthy cholesterol that brings the cholesterol back from the arteries to the liver to get it out of the body. So that's good. Then we looked at this advanced risk analysis. Fibrinogen, HDL, homocysteine, HSCRP, LDL particle number, all normal. In fact, her LDL particle number is 30% lower than the man that had the 198 cholesterol. It was only 1,350. His was 1,850. So this lady's got lots of HDL, and she's got big LDL particles that are not dangerous, or not so dangerous. Everything else was normal. So in this patient too, you got to wonder, are we still missing something because the cholesterol's high? So this is where now that advanced imaging really makes sense, where we look at, we got, conflicting information on the cholesterol testing on both of these. The first one, the standard cholesterol looks normal, the advanced factors looked abnormal. And this woman, the total cholesterol looks really high and, is shocking to anyone, but everything else looks normal. So we look at something called a carotid, well, it's a CIMT, carotid wall thickness. And this is done by ultrasound, and it's non-invasive. It's not terribly expensive, about $100 actually to do. And it tells us if that blood vessel's healthy. And there's great correlation between the health of these blood vessels and the health of the blood vessels on the heart. These blood vessels are important enough, but they also speak to us about the blood vessels on the heart. So what we look at is there plaquing, is there thickening of that arterial wall in the carotid? And if there is, in either of those two people's situation, it's going to raise their risk and make us think about putting them on medications. So that's the carotid ultrasound, and that's how we use it. Now there's another test called the coronary calcium scan. And this is a CT scan without an IV, takes just a couple minutes to be honest with you, and you go through it, and it's able to pick up all of the calcium in any of the arteries on the heart. There are 3 major arteries on the heart, and it can tell us specifically if there's calcium in there. And the calcium resides with any of the plaques. So if the calcium score is 0, which we see about half the time on people like this, if it's 0, their risk of having a heart attack in the next 5 years is really low. Really low. And this is, on the other hand, if we did this test on that man that had the normal cholesterol and it was elevated, then that's clear he's got risk. He's developing plaque in his arteries, serious plaque in his coronary arteries. This is another picture of that. If the score is 0, very, very low risk. If it's between 0 and 100, mild risk. Between 100 and 400, moderate risk. And over 400, it's extensive risk for a coronary event. We see some of those every week as well. So now we have a better understanding about how to look at cardiovascular risk, how to understand what happens in the blood vessels for heart attacks. And I think we have a better understanding how we can individualize, personalize medicine for you as individuals here. In regards to prevention, that just works for everybody. Dr. David Katz, who's a professor at Yale Public Health, he's a major educator in public health in this country, said there is nutrition and lifestyle and then there is everything else in medicine. So, what we do at this hospital with advanced surgical procedures and imaging procedures and medical care, right, is very important, makes a difference in lots of lives. But prevention dwarfs that as well. The things we can do to lower, if you can lower risk by 93% diabetes, 81% of heart attacks, 50% of strokes, and 36% of cancer. I want advanced medicine that I'm part of to continue to sharpen their tools, right? So that we can treat all of these things that occur, but I'd sure like to prevent most of them. Dr. Katz said there is immense power in our forks, what we eat, in our feet, how we move, and our fingers, like this. You've memorized this slide already, haven't you? There was another, there were several other studies like this, but this is just one other I'll just pick, and this was the summary from this important European journal, the journal Lancet, and they said that eating fruit and vegetables, taking a bit of exercise, avoiding smoking could lead to an 80% lower risk of heart attacks. So 80%, it's about the same. These studies are consistent now. This is really good data. So the things we need to do, don't smoke, eat colorful plants. We're going to talk more about that. There is no question that the most important thing you can do in your diet is to add colorful plants every day. That is just incredibly powerful. It will lower your inflammation and it lowers your cholesterol, does lots of great things. You want to eat healthy fats. Okay, hold on to your seat here. I said eat healthy fats. I see a few snickers and a couple smiles and a couple like, what are you talking about? Well, I'm going to show you a couple studies that I think is going to rock the world here and around the country that have just been published about healthy fats in our diet. You need to move every day and you need to maintain a healthy weight. This is what we do to prevent disease. This is not, now when I mean colorful food, this is not what I'm talking about. So this is what this middle American family ate for a week. There are some fruits and vegetables there, but there's a lot of processed stuff, and that just has the wrong kind of fats, has the wrong kind of carbohydrates in it. These days, folks, carbohydrates play a big role, and processed carbohydrates like breads and pizzas and crackers and chips are very terrible for increasing our cholesterol. So when you eat sugary things, drink sugary drinks, or eat chips or potatoes or those kind of things, pasta, you actually, with those things, those sugary plants and starches and sweets, increase the fat in your blood. In fact, it's a bigger cause of increasing blood cholesterol than is fat for most people. Wow. That's colorful plants. Dr. Walter Willett, one of the major and most respected scientists in nutrition in our country, said white bread, white rice, white pasta, potatoes, sodas, and sweets are 30 to 40% of most Americans' calories, and there is nothing good about them, nothing. They lead to only harm, weight gain, diabetes, coronary heart disease, and cancer. So that whole group of foods there lead to a lot of disease in our country. And when we told you, that is the medical guild that I'm from, told you to stop eating fat in the 1980s and 90s, we were wrong. Because what we got you eating is a lot more of this. We were wrong, and I'll show you more on that. Dr. Willett said, choose a wide variety of vegetables and fruits. Don't include white potatoes as a vegetable. They're just sugar. Starch is just sugar molecules, right? Go easy on fruits that are higher in carbohydrates like oranges, bananas, apricots, grapes, etc. Don't include fruit juices in your diet because they are very sugary. Okay? Okay, so this is the amazing story of oil, and it starts right here. This is the Predimed study, and what they did was they looked at groups of people, two groups. Both groups were on the Mediterranean diet. They ate the best and healthiest diet in the world. In one group, they said, okay, now we want you to eat more fat every day. We want you to have either a couple servings of nuts or 4 tablespoons of olive oil daily. So we got the best diet in the world on the left and the best diet on the world with extra fat on the right. 30% less heart disease and stroke in the patients that had more fat. So when I'm going to paint this picture for you about fat, and I'm going to tell you that it's not a fad. It's based on enormous data, hundreds of thousands of people over the last 5 to 10 years. It's really changed things. So this is January 20th, 2016. Major study on fat. It said, the findings of our study highlight the importance of ending America's fear of fat, all fat. We estimate that nearly 50,000 Americans die needlessly each year because they're not eating enough fat. Wow. They're very decisive, very big study. They go on to say we should reduce some unhealthy fats like saturated fat and trans fats, and I'll talk to you about where you find trans fats in a minute, and replace them with healthy fats from plants and nuts. This is a big change. They went on to say that we found that in most countries, too little intakes of healthy fat was much bigger problem than eating saturated fat. That too little healthy fat was a much bigger problem than eating saturated fat. They said instead of 2 slices of bread, have 1 slice of bread or a half a slice and douse it with olive oil. Or just ditch the bread and have the olive oil. No kidding. I mean, or enjoy some wonderful bread, but not as much, and use some olive oil. Yes, ma'am. Coconut oil. The question is, what about coconut oil? Coconut oil is a fat from a plant, but it's an interesting fat in that it's primarily saturated fat. Although many people are using coconut oil now, there's no scientific data that says it's safe in high quantities in human beings. Now, there's a lot of scientific data that says that olive oil and oils from nuts are not only safe, they're beneficial. So I don't know what's going to happen in the next 10 years about coconut oil. We use it in our home, but not a whole lot. It may change, and we'll know that coconut oil is one of those oils from plants that is just fantastic. But we don't have that data yet, and I certainly don't recommend that people decrease. I recommend that you use the oils that we have the data on already. The nuts, the olive oil, and other oils like that. So the bottom line here is eat more fat from plants, olives, and nuts. And avoid trans fats, and I'll talk to you about these in just a minute. You want to consume high-quality omega-3s from fish. And again, olive oil, nuts, but avocado is a terrific oil to eat. And you want to use modest amounts of meat and dairy. And I didn't explain this before, but when I say saturated fat, I'm primarily talking about the fat that's from dairy products, milk and cheese, and from meats, okay? Now, it does turn out that if the beef you eat is a grass-fed animal, that the fat is different. It's less saturated and more omega-3 in that animal. So there's more data coming out on all of this on how to optimize our health. So trans fats, which are really the worst of all fats, trans fats are, they increase our LDL, the lousy cholesterol, and at the same time they decrease the healthy cholesterol. So that's exactly what we don't want to happen. We can find trans fats sometimes on the label where it says there's some trans fats. And sometimes it's not on the label and it'll say 0 trans fats, but there's really trans fats there. So we need to read labels and we need to look for things like this. So if you were going to pick peanut butter, the one on the left, you can see that there's a whole lot of ingredients. And one of the ingredients is sugar. Another one is fully hydrogenated vegetable oil, which is a code word for trans fat. If you see hydrogenated oil on the package, don't buy it. Look for it. Now, the ingredients on the one on the right is peanuts and salt. You can go to any aisle almost in the grocery store, and you can look for things. You can go to the dairy aisle and look for the yogurt, pick up the labels, and look. You want yogurt that's basically milk products and maybe a little fruit. You'll pick up another one, say like a Yoplait, that's it's a frankenfood that has a bunch of other stuff in it that makes it sweet and makes it smooth and makes it last long and makes it pretty colored, right? Marinara sauces, you can go and pick up a pizza sauce or a spaghetti sauce. You can pick up a pizza sauce or a spaghetti sauce, and the same thing, some of them will have tomatoes and garlic and basil and onions and olive oil. That's the one. Pick up the other one, and it has sugar and hydrogenated oils and colorings and all, read the labels. And if you go to the store and read the labels, get used to it, pretty soon you know the products that are good, and you don't have to spend hours in the grocery store studying. So this is a summary of the food here. Are we off? We're off. There it is. What would you have to do before? Okay. I'm back here. Forgive me for that. So this is a summary here of food recommendations. The base of your food pyramid should be vegetables, not pasta and bread. You want to eat lots of beans and lentils. And if you have a grain, you want to eat the grain in the whole form. And I invite somebody to ask me a question about that. In the whole form. So what people say and they look for these days is finding a whole grain product. So you can go find a whole grain bagel or a whole grain bread, right? But what that is grains that's ground into powder and made into a bread, and so that has a very high sugar content to it because all of the starch is broken down. But instead, or a Cheerio, for example, where it's ground into powder, made into a Cheerio, and that's heart healthy, right? Well, not so much. If you instead had that oatmeal, that the grain is in the whole form, that's what I mean by whole form grains, or if you have quinoa, which is a grain in the whole form, or a wheat berry in a whole form, lots of different things, your body has to break that down, and it takes hours to break it down. It releases its starch very slowly. When you eat a Cheerio, it releases its starch in minutes. Your blood sugar's up. And that drives blood fat and blood inflammation. Yes?
Flaxseed, you should eat that and you need to grind that up.
So flaxseed you want to grind. It's a little bit different because you're trying to get the constituents and the oil from inside of it. And so she asked about flaxseed. What about flaxseed? And that's better ground because everybody knows that's eaten unground flaxseed. That it stays unground and actually fully formed when it's eliminated later that week. Yes.
So you're saying even if it says grain bread.
Yeah. I don't recommend bread for many people, except occasionally, or, to have, a couple of slices of toast with breakfast here, forgive me. A couple of slices of toast with breakfast. Oh, goodness. I better just stay put, huh? A couple of slices of toast with breakfast and a sandwich for lunch and pasta for dinner, you're getting way too much processed wheat. It really drives diabetes in our country. When, in 1960, just about 15% of us were obese, right? In 2010, about 35% of us are. At the same time, the amount of fat we ate went down and down and down, and the amount of carbohydrates we ate went up and up and up. And it's the processed carbohydrates that are problematic. Did you have a question back there? So sprouted Ezekiel bread is a bread that's it's also ground into a finer powder and made into bread. So it has some benefits to it. And actually the bread that's coarser and has bigger chunks to it is going to be slower to digest. But in general, I know we all love bread in here, or many of us do. And so it's in general anything that's made into a powder and then ground, milled, right? And then made into something else is going to have a high glycemic index, which means it drives our sugar and eventually our fat in our bloodstream and increases the risk of diabetes and obesity, et cetera. Doesn't mean you can't ever have it, but it's not a health food in general. So beans and lentils and whole grains for sure, and fruits, but less if you're a diabetic. So what I'd like to say these days is eat lots of vegetables and fruit, and not necessarily fruits and vegetables. Vegetables are the most important thing. You can certainly have meat, fish, poultry, and eggs, whole dairy and cheese, nuts of all kinds. Nuts of all kinds are great for us. Everybody should have a handful a day. Oils, olive oil in particular I love, and sweets at the bottom of the pyramid, okay? So you can have some sweets, but it shouldn't be too many, right? And then you add a dash of love and you have a wonderful diet. Yes, ma'am.
So if you're diabetic, the natural juices in fruits are not healthy for you?
Yeah.
The sugars in fruits?
Yeah, so if you're a diabetic, are the natural sugars in fruits good for you? When you're a diabetic, unfortunately, your body can no longer tolerate sugar. And sugar comes from anything that has sugar in it, whether it's, a Pop-Tart or whether it's an apple or whether it's a banana, etc. All of those things, although we think fruit sugar means healthy, when it turns out to the real metabolism, and somebody, I mentioned before that fruit juices aren't the greatest thing to drink for us. If you have a glass of orange juice right here and a glass of Coca-Cola right here, they're both going to drive your sugar very high as a diabetic. And the same thing with fruit. If you have, a large bunch of grapes, that will drive the blood sugar of a diabetic very high. So diabetics are much better off really lowering their carbohydrates. In fact, there's great studies on this in the last couple of years where you want to eat primarily non-starchy vegetables, and you want to eat berries as your fruit, and good amounts of healthy meat and fish. Okay? That's the treatment for diabetes. And I have a person just recently that came to my office with a high hemoglobin A1C, which is the diabetes number, right? It tells us how high the blood sugar was. And within just a few weeks, we put them on a low carbohydrate diet, and the blood sugars came down from 180, 160, 140. And today when I spoke with him, it was 85 to 110 with no medicine. No medicine. So when you're a diabetic, you cannot handle sugar. And the way we teach to manage sugar in medicine is to say, eat this much sugar with each meal. Eat this much sugar, say 40 to 50 grams of sugar with each meal, and take this much insulin. Instead, you can move the carbohydrates out, the sugars out, and you don't need as much insulin at all. I mean, there's type 1 diabetics, the worst kind of diabetes, that are very insulin dependent. When they eat a low carbohydrate diet, one with lots of green leafy vegetables and lots of different vegetables and berries and good meat and fish and healthy nuts and things like that, they're on very low doses of insulin, 3, 4, 5, 6 units a day. It's amazing. Somebody else had a question. Yes.
Some of those extreme books say that we should stay away from legumes, like the lentils and beans, because they have a high glycemic.
The question was, what do you think about lentils and beans because they have a high glycemic index? When we say glycemic, we mean they drive our blood sugar. And those extremes they're just uninformed. Beans and lentils are absolutely excellent for almost every one of us. And the reason they are is because they have some starch, but they have a whole lot of fiber. So the starch is let out very slowly. Beans and lentils, just great food. Great food. Thank you for that question. 1 serving a day of greens, berries, and nuts lowers your heart disease risk by 50%. It doesn't matter if you're walking, doesn't matter if you're doing other things. If you just do that, you can lower your heart disease by 50%. There's a diet here that's been studied to lower cholesterol by 15% just by eating these foods. It's called the portfolio diet. If you want to eat a handful of tree nuts a day, some soluble fiber from things like oats and okra and eggplant and apples. You can eat this substance called a plant sterol that's available in certain over-the-counter, what they used to be called margarines, but Smart Balance is not a bad margarine in that it uses olive oil and other plant oils, and it puts this plant sterols in it. We can also give you a plant sterol on a pill to lower cholesterol. Beans, soy, and lentils, there's your beans and lentils, those lower cholesterol. And artichoke. Natural supplements for prevention of coronary heart disease. We use these a lot in our clinic to lower cholesterol. Red yeast rice works like a statin but has less side effects. The plant sterols. Those are what I just talked about that you can take in a pill to lower cholesterol. Niacin is vitamin B3, lowers cholesterol. Berberine, which comes from some plants like golden seal and Oregon grapefruit, lowers cholesterol and diabetes and sugar in diabetics. Aged garlic is helpful. Curcumin is a derivative of the spice turmeric, and it lowers inflammation in blood vessels. Green tea lowers inflammation in blood vessels. Resveratrol comes from grapes, and it comes from wine, and it lowers cholesterol. Quercetin does as well. And lycopene comes from things like watermelon and tomatoes. All of these things are known to naturally lower cholesterol. And we have a supplement in our clinic, it's called Lipocardia, that combines all of these together in one packet twice a day. And it significantly lowers cholesterol in a very, very safe way. Yes, ma'am? So yeah. So the question was, what about the starchy rooted vegetables? Are those okay for us? And it turns out that many of them are. If you're going to cook beets, even though they're a little sugary, if you cook them and steam them, they're a pretty darn good food. Rutabagas and parsnips and those kind of things, those are starchy and fibrous at the same time, kind of like a carrot, right? So I really love those, and I'd like you to add them to your diet if you like them. I know we do. So these are a couple books that you might be interested in. This is Dr. Gundry's Diet Evolution. Dr. Gundry is a heart surgeon that was getting tired of doing blood vessel surgery on people over and over. So he learned about a really healthy diet. And then there's the Whole Heart Solution, and this is a vegetarian approach to heart disease by a physician, Dr. Kahn. Both are very good. So I hope what's happened tonight is that you understand more about coronary heart disease, that you understand better about your own risk, that lipid panels can be helpful, advanced lipid panels can be helpful also, that carotid ultrasound called the CIMT can help us define an individual's risk. How are their blood vessels doing? We can look at them and it's very safe. And if we need a more advanced imaging test, we can use that CAT scan called the coronary calcium scan. You want to move daily, don't smoke, add healthy fats. Now, it doesn't shake you up so much this last time, does it? The add healthy fats. Maintain a healthy weight. And the key is to eat a whole lot of vegetables. And I really like multicolored plates, like, having the white cauliflower or the parsnips, having the red beets, having the carrots, having the tomatoes. All of those different plants and different colors give us wonderful nutrients that help inflammation and provide health benefits for us. And if you do these kind of things, these sorts of things, you decrease your coronary heart disease risk by 80%. So heart health, it's about wisdom, and it's putting this information into practice. Heart disease is a big killer in this country, and we have the key to the prevention.